Hello everyone, in today's video we'll be learning about some basics of the trigeminal nerve, focusing mainly on the ophthalmic branch. So if you're aware of the following mnemonics, that is one, uta fagwa, or the second one that goes, oh, once one takes the anatomy finals, very good vacations start happening. You probably know that there are 12 pair of cranial nerves, numbered based on the order they arise from the nuclei present in the brain, except for 11 and 12, which are reversed. And if you know the other mnemonic, that is, some say money matters, but my brother says big brains matter more, you probably know that type of cranial nerves. Therefore, the trigeminal nerve is the fifth cranial nerve, which is mixed type of nerve. That is, it has both motor as well as sensory components. The trigeminal nerve is the largest cranial nerve and is the nerve of the first brachial arch. Through its three branches, namely the ophthalmic, maxillary, and the mandibular branch, it is the chief sensory nerve of the face. It also provides sensory distribution to the nasal cavity, the paranasal air sinuses, eyeball, the oral cavity including the palate, cheeks, gums, teeth, anterior two-thirds of the tongue, and also the supratentorial part of the dura mater, which explains the common set of symptoms, that is the headache, common colds, sinusitis, that usually arise when any of the aforementioned area is affected. The nerve is composed of a small motor root and a larger sensory root. The sensory root arises from three sensory nuclei, namely mesencephalic nucleus, principal sensory nucleus, and the spinal nucleus. The root enters the concave portion of the trigeminal ganglion and exits as three sensory divisions, namely ophthalmic, maxillary, and mandibular. From the motor nucleus arises a small motor root which travels anteriorly along with but completely separate from the sensory root. At the ganglion, it passes in a lateral and inferior direction towards the foramen ovale, through which it leaves the middle cranial fossa along with the third division of the sensory root, that is the mandibular nerve, after which it unites with it to form a single nerve trunk. Hence, only the third division, that is the mandibular nerve, contains both motor and sensory fibers. Ophthalmic division is the first branch of the trigeminal nerve, also the smallest one, which is exclusively sensory. The nerve from the ganglion travels anteriorly in the lateral wall of the cavernous sinus to the medial part of the superior orbital fissure, through which it exits at the skull into the orbit. Just before passing through the fissure, it divides into its three main branches, the nasociliary, the frontal, and the lacrimal branch. The nasociliary nerve travels anteriorly along the medial border of the orbital roof, supplying the nasal cavity and ending at the root of nose. It gives off a branch to the ciliary ganglion via short ciliary nerves and divides into two or three long ciliary nerves, posterior ethmoidal, anterior ethmoidal, and infratrochlear nerve. The long ciliary nerves innervate the eye and contain sympathetic fibers to the dilator pupillae muscle. The anterior ethmoidal nerve innervates the mucous membranes of the frontal, ethmoid, and the sphenoid sinuses and the nasal cavity, while the posterior ethmoid nerve innervates only the sphenoid sinus. The infratrochlear nerve innervates the bridge of nose, the upper eyelid, and conjunctiva. The frontal nerve travels anteriorly into the orbit and divides into two branches, the longer supraorbital and the shorter supratrochlear nerve. The supraorbital branch supplies the upper eyelid, conjunctiva, and to the scalp as far as back to the lambdoidal suture, while the supratrochlear nerve is limited to the forehead. Apart from its three main branches, the ophthalmic nerve, after arising from the trigeminal ganglion, travels lateral to the cavernous sinus to give rise to a meningeal branch, that is the recurrent tentorial branch. The lacrimal nerve supplies the lacrimal gland and also receives parasympathetic fibers from the zygomaticotemporal nerve. It supplies the lacrimal gland, the upper eyelid, and the conjunctiva. So, in a nutshell, the ophthalmic division provides sensory innervation to the skin and mucous membrane of the structures derived from the frontonasal prominence. So, the following table summarizes the branch and the innervations. So, you can pause the video and relate to it with the schematic diagram above. So, that was all. See you in the next lecture.